From the nation's capital to Green Bay, health care is a major issue, and that's why President Obama will be here to pitch his plan for reform.
Yeah, the president says he wants a bill in place by the end of July, and Fox 11's Mark Leland has more. Hi, Mark.
Good morning, Pete. Good morning, Rachel. The price tag for the reform plan could be $1 trillion. That's a lot of money. St. Norbert College professor Charley Jacobs joins us now with more, talking about the health care plan and President Obama's visit here today. In his plan, he doesn't really outline a specific plan at this point. He's still out trying to get information and talk to the people out there, but he does want lower costs, better quality, and coverage for the uninsured. How doable is that?
Well, there's a problem because those really aren't mutually exclusive. They're interrelated and interactive. And so if he tries to, or if Congress tries to tweak one of them, all three get tweaked. So if you want to increase coverage, you're going to increase costs. But of course, his overall goal is to keep costs as low as possible. If you control costs, what happens to quality? Will quality go down? And of course, he's trying to improve the overall delivery of quality health care to individuals. So it's a dance that he and Congress are going to have to try to accommodate, and one which is going to be rather difficult to do.
Now, we have currently about 45 million Americans that are uninsured right now.
That's the latest numbers.
How do we give them insurance without raising the costs?
Well, part of it may be a demand upon employers to provide that and create some sort of tax incentive to do it. There also may be tax incentives for individuals who purchase health care on their own and contribute to more universal health care. So there are incentive programs. I think the big concern in Congress is creating a new tax. Anything that's going to be perceived as a new tax is very disfavorable to the public. I mentioned when we spoke before that 67% of the public approves of health care reform. Only 47% approve if there's a new tax. So there's the other balancing act. How do we pay for what Americans want?
And the other issue is reducing waste. I mean, according to some experts, there's as much as 40% waste in the health care dollars right now.
It's a keystone of the 8 general principles that Obama has outlined. He wants to try to create ways in which we can reduce waste, especially in the billing process, in the delivery of services. There is evident waste that has been determined in the federal programs that exist right now. I think there's a worry that if you don't eradicate those now, you're going to replicate them in a new program. So there's another effort that's sort of a political landmine for Obama and for Congress.
Now, when you're talking about government-run health insurance program, is this the first step to universal health care?
Obama has said from the start, although universal isn't something he wants to achieve immediately, it is a long-term goal, universal care.
And Republicans seem against that idea.
They have a rather large trust in the market economy, and so they want to reduce the influence of government. They believe that delivery will be of high quality and more efficient if the markets take it instead of government.
Now, President Clinton tried to do this a while back. It didn't work. This time, coming here to Green Bay, that's the first step in getting the public support behind it?
I think that's what he's trying to do, is to demonstrate to Congress that it's not a top-down type of imposed health care program, that he's really trying to see what the grassroots wants. And if he can get the public behind it, there's going to be little recourse for those in Congress if their constituents want them to pass something this year.
And getting legislation by July or even the end of the year. I mean, how are we going to get them all together?
It's kind of like herding kittens.
Yeah.
So I'm not sure how successful they're going to be, especially with the August recess coming up, which every member of Congress always looks forward to. So it might be after August. But
herding kittens, not easy task.
No, it isn't.
All right, thank you. Charley Jacobs joining us.